Welcome to Anatomy Head and Neck video series. Today our talk will be about the roof of the oral cavity. Mainly we will talk about hard and soft palate. So let's start. Hard palate, which is made mainly by the bones of palatine process of the maxilla, which is we are seeing now in the blue, and also by the horizontal plate of palatine bone. Hard palate anteriorly and laterally are surrounded by the upper alveolar arches from maxilla. Also posteriorly we have the soft palate and some landmarks we will see in the hard palate. This is the hard palate and this is the soft palate. Soft palate come posterior to the hard palate. In the hard palate we can see a transverse palatine folds called palatine rugae. We can see them like this. Also we can see palatine raphe, which is a median longitudinal ridge here. Also we can see incisive papilla here. So this is the anatomical landmarks that we can see them in the hard palate. Let's talk about soft palate now. Soft palate continues posteriorly from the hard palate. It acts as a valve. Depression help in closing the oropharyngeal isthmus, and the elevation of the soft palate help to separate the nasopharynx from the oropharynx, and this is helping in swallowing of the food. Muscles of the soft palate are 5 muscles. We can see them here. First muscle is the tensor villi palatini muscle, which is this muscle. Not this muscle. This is tensor villi palatini muscle. If we are going to see the origin and insertion of this muscle, here is a very close look. It originates from the saphenoid fossa of the saphenoid bone here, and it's inserted in the palatine aponeurosis here. Okay. Innervation of this muscle will be from the mandibular nerve, mainly from the branch to medial pterygoid muscle, and the function of this muscle will be tenses the soft palate and opening the pharyngeal tympanic tube. Okay, so the tensor tympani muscle will act as tensor for the soft palate. Also, it will open the pharyngeal tympanic tube. If you want to see the levator villi palatini muscle here, and we are going to see the attachment, it originated from the petrous port of temporal bone. Here the origin is from the temporal bone, mainly the petrous port. Insertion will be superior surface of palatine aponeurosis here. Okay, nerve supply will not be the mandibular nerve, but the vagus nerve, cranial nerve number 10, mainly from the pharyngeal branch to pharyngeal plexus from the vagus nerve. The function of this muscle will be only muscle which make an elevation for the soft palate above the natural position. So the levator villi palatini muscle, it's the only muscle that makes an elevation for the soft palate. Third muscle we want to talk about, it's the Palatopharyngeus muscle. Make an attachment to the palate and the pharynx. Origin is from the superior surface of palatine aponeurosis. The insertion will be in the pharynx, pharyngeal wall mainly. Nerve supply also will be from the vagus nerve, from the pharyngeal branch of the vagus nerve. See how this nerve is interrupting this muscle, and the function will be depression for the soft palate or elevation of the pharynx. Either it will elevate the pharynx or it will make a depression for the soft palate. Now let's talk about the fourth muscle, which is the Palatoglossus muscle. Palatoglossus muscle take an origin from the inferior surface of palatine aponeurosis. It's inserted in the lateral margin of the tongue. See how it come into the tongue? This is our muscle. The innervation also will be from the vagus nerve and from the pharyngeal branch of vagus nerve, and the function will be also rather than depression of the soft palate or elevation of the back of the tongue. So Palatopharyngeus muscle will make depression of the soft palate, elevation for the pharynx. Palatoglossus muscle, depression for the soft palate, elevation for the tongue. Last muscle we want to talk about is musculus uvula. Musculus uvula will take origin from posterior nasal spine of the hard palate. We can see it clearly from here. The origin will be from posterior nasal spine of the hard palate. Insertion will be the connective tissue of the uvula. Okay. Also, it will take innervation from the vagus nerve, mainly pharyngeal branch, and function, elevation and retraction for the uvula, thickening of the central region for the soft palate. So the musculus uvula will elevate and retract the uvula, making a thick center for the soft palate. If we want now to move to the blood supply for the palate, we will see that we have 3 arteries supplying the palate. First one is the palatine branch of ascending pharyngeal artery, and I'm so sorry that it's not represented here, but I didn't find it in this application. So the first artery supplying the hard palate is the palatine branch of ascending pharyngeal artery. Second one will be greater palatine artery. This is the greater palatine artery that come in the palatine canal and give origin for lesser palatine artery. Here we can see lesser palatine artery. And lesser palatine artery also, it's a blood supply for the palate. Lesser palatine artery will pass through the lesser palatine foramen, which come somehow posterior to greater palatine foramen. These arteries supplying the palate, ascending pharyngeal artery, mainly the palatine branch, greater palatine artery, and the lesser palatine artery. Venous drainage will be through the pterygoid plexus, which we are seeing here. This is the pterygoid plexus. Pterygoid plexus will drain either directly into the fascial vein or will drain into the pharyngeal plexus of veins, then to the fascial vein. So either it will drain directly to the fascial or to the pharyngeal plexus of veins. The nerve supply will be greater palatine greater palatine nerve. Here we can see the greater palatine nerve. Greater palatine nerve will supply the hard palate and the gingiva just to the first premolar tooth, as we can see here. Here is the first premolar tooth, and the greater palatine nerve will supply the gingiva of the upper arch until we reach the first premolar tooth. Also, we have lesser palatine nerve, which is passes posteriorly to the soft palate. Lesser palatine nerve will supply mainly the soft palate. Here we can see the lesser palatine nerve, and the nasopalatine nerve, which will supply. Here we can see the nasopalatine nerve. Here is the nasopalatine nerve, which is supplying the hard palate and the gingiva of anterior teeth, which are the incisor, lateral incisor, central incisor, and the canines teeth. Okay, so innervation, we have a greater palatine nerve supplying hard palate and the gingiva of teeth of the upper arch until we reach a premolar, first premolar. Lesser palatine nerve, and also we have the nasopalatine nerve, which is supplying the hard palate and the gingiva of teeth until we reach the first premolar, just for the anterior teeth. Thank you for listening. See you in the next video.